Hi, you guys. Welcome back for our daily practice questions. It is day 19, but as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer reminder is that there is no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 68-year-old male presents with a 5-day history of cough, fever, chills, pleuritic chest pain, and shortness of breath. On exam, he has crackles on auscultation of the left lower lung, and his temperature is 101.2 degrees. A chest x ray reveals a consolidation in the left lower lobe. What is the most likely diagnosis? Is it A, acute bronchitis, B, community acquired pneumonia, C, pulmonary embolism, or D, COPD? Take a moment and tell me what you got. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most likely diagnosis? And y'all know I always say if they're asking for a diagnosis, you need to run it back and look at the assessment findings. So, and when I say look at the assessment findings, how are they presenting? What are the signs and symptoms? What is noted on exam? And I always say also pay attention to these three things if provided: their age, their gender, and their ethnicity. Okay. So here we have a 68-year-old male who comes in with a 5-day history of a cough, fever, chills, pleuritic chest pain, and shortness of breath. This should start to make you begin to think of differential diagnoses, right? With pneumonia being one of those, right? He also has crackles, a fever, and as well as a confirmatory diagnostic exam of the chest x-ray showing consolidation in that left lower lobe. Now, why I am pointing these things out. This confirms the diagnosis of B, community acquired pneumonia. But also, when I tell y'all to study in assessment, diagnosis, evaluation, and treatment, and I also tell you when we are reviewing things, say you've been unsuccessful before, they give the report and it shows that you're low, medium, high in these areas. This is things that I mean when I'm telling you to focus on this. This is a prime example of a diagnosis style question criteria that they are scoring you on. Not only are they asking you for the most likely diagnosis, but they're providing you with the signs and symptoms so that you're able to determine a differential as well as making sure that you understand the gold standard diagnostic exam. So I gave you this question to kind of show you like consolidation of the left lower lobe. That is a positive of the chest x-ray for pneumonia. But you have to know what a positive looks like and also understand that the chest x-ray is the gold standard. So this is how they begin to score you in that category of diagnosis. So when I'm working with you and I'm telling y'all to study in this fashion and breaking it down in this fashion and understanding the gaps that you have in this is what I mean. So when you walk through, make sure you're studying all the way through so that you're not missing these key pieces. All right, question number 2. A 25-year-old female presents with a 3-day history of fever, cough, and malaise. She reports feeling progressively more fatigued and is experiencing mild shortness of breath. On exam, her temperature is 100.6 degrees, and she has a productive cough with yellow-green sputum. Chest auscultation reveals mild wheezing but no focal crackles. A chest x-ray shows a patchy infiltrate. What is the most likely diagnosis? Is it A, influenza, B, community-acquired pneumonia, C, asthma exacerbation, or D, acute bronchitis? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most likely diagnosis? So again, when they're asking for a diagnosis, you need to run it back and look at those assessment findings. So we have a 25-year-old female who came in with a 3-day history of fever, cough, and malaise. She reports it getting progressively worse, more fatigue, more shortness of breath. On physical exam, she does have a low-grade fever. She has a productive cough that is yellow and green with sputum. Her auscultations do show mild wheezing, no crackles, no focal crackles, I should say. And the chest x-ray shows a patchy infiltrate. Now, her presentation can make you think of many differentials, right? It can take you down, does she have the flu? Does she have bronchitis? Does she have a cold? Does she have pneumonia? Going through all the things. But that chest x-ray again shows patchy infiltrates. What does that tell you? That's that confirmation of community acquired pneumonia, right? So, again, just another example of those diagnoses and differentials as well as diagnostic exams so that you are tying these together as you're studying. And then lastly, question number 3. A 55-year-old male with no significant medical history presents with a 4-day history of cough, fever, and chills. His chest x-ray shows a consolidation in the right middle lobe. Based on clinical guidelines for an outpatient with no comorbidities, what is the first-line treatment for his community-acquired pneumonia? Select the best two. Is it A, oral doxycycline, B, oral amoxicillin, C, oral azithromycin, or D, oral levofloxacin? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, based on the clinical guidelines for an outpatient with no comorbidities, what is the first line treatment for his community acquired pneumonia? And select the best two. All right, and that stem tells you everything you need to know of what this question is looking for. So what are those first line treatment options for community acquired pneumonia for people with no comorbidities, right? So you can go with your amoxicillin and your azithromycin, right? B and C. Amoxicillin and azithromycin. The latest guidelines of pneumonia that they are using on boards, remember, our first line therapy are macrolides, meaning they end in myosin, like our azithromycin, as well as high dose amoxicillin are those first line therapy options for people with no comorbidities. Okay. All right. So as you can see, we have been going through ENT over the past several weeks. Now we're moving into our respiratory system. And so I will be navigating y'all through these areas as well. If you notice a pattern, I'm trying to get y'all through the system so that you will be stronger and feel more prepared with these areas. But make sure that you are studying the appropriate guidelines that the test is currently testing on. Okay. So I hope that you found this helpful for our pneumonia portion. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, everything that I offer is linked in the bio of this channel, including my website. And if you are looking to book any of my one-on-one sessions, custom packages, or coaching and tutoring, I always say either call, text, or email so that I can speak with you to gauge what you truly need to make sure you're booking the appropriate session type. As always, feel free to reach out to us. Telephone number is 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.